And this is a huge one because sometimes we just feel like, well, it's probably nothing. Maybe it's just carpal tunnel, or maybe I just slept wrong. But the problem is weakness on one side can be a symptom of a stroke or an area that's blocking in the neck or in the brain. And so when you're noticing this, particularly if it's something you've never experienced in the past, that's something to take very serious and to let your medical profession know.
Okay, number two on the list. This one I found really interesting because I just sort of assumed this is part of the aging process. But hearing loss, why should you really pay attention to hearing loss?
Well, most of us, our senses actually help us to be able to determine kind of what's going on around us and be able to protect ourselves. So as we start losing hearing, and yes, there is some component of that with aging, the problem is if you ignore it and just let it continue to compound, you can set yourself up for risk for increased accidents, increased opportunities of missing something in your surroundings that will put you at risk for falls or other areas that can put you in danger.
It sounds like this is something that can be treated in many different ways, too. So, no need to let it prolong.
Absolutely not. From hearing aids, doing a simple hearing exam to determine if you could benefit from a hearing aid, to just being aware that if your hearing is decreasing, that you may need to make some adjustments to your phone, because there are some ways that you can actually change your notifications so that if there's any emergencies, that your phone will notify you, that will bypass the need for great hearing. And so just being aware that this is a new symptom you're experiencing can help you progress in the direction of protecting yourself.
Also on the list, unexplained weight loss. I would normally take that as a good thing.
You're right. I think most of us, if we lost 20 pounds, within a couple of months, we'd be like excited. That would be an exciting thing. But the problem is if you're losing those 20 pounds and you were not intentionally trying to lose them, that's often a sign that something more serious is happening. Diabetes, particularly early onset when it's first beginning, oftentimes presents as unexplained weight loss, as do many cancers and other forms of advanced progressive chronic diseases. So if you're attempting to lose weight and you're exercising and cutting back calories and the pounds are dropping off, fantastic. If they're dropping off and you are doing everything you've always done, you haven't changed your eating or exercise habits, that's concerning and should be evaluated.
Okay, next on the list, we've got feeling hopeless.
Yes, depression is something that's very sneaky for a lot of people. And a part of that begins with a feeling of hopelessness and this feeling of not really having anything to look forward to. And I think because we have gone through a very difficult year, a lot of us are processing some hard emotions. We're processing through some of the trauma of the lockdown and all that we've experienced. And so I think it's important to be aware if you feel as if that you've gotten into this place where you're not looking forward to the future, that you really don't see any hope, then that's something that can be treated. That's something that therapy and counseling can actually benefit greatly with. And it's not something that you have to continue to suffer with, that there is help.